My name is Shobhit, and today I am going to talk about lessons learned while building a privacy operations center at Headspace Health. Before I jump into the talk, a bit about me. I am currently the Security and Compliance Director at Headspace Health. Before that, I had security and GRC roles at HSBC, Deutsche Bank, PayPal, Fidelity Investments. I did my master's in information assurance and cybersecurity at Northeastern Boston. And I'm highly interested in healthcare compliance, privacy, running, and writing. So if you have similar interests as mine, please feel free to connect after the talk, and we can have a very good conversation. So what are the goals for the talk today, and why we are here to speak about the Privacy Operations Center at the first place? The goal is to speak about why build a dedicated POC at the first place. Secondly, I also want to talk about some of the considerations for building a privacy operations center. And lastly, I want to leave you with some guidance on initiating successful privacy programs across multiple org, be it engineering, privacy, product, or legal. With the goals, I also have a few assumptions that you have some familiarity with privacy laws, such as GDPR, CCPA, CPRA, and you are kind of aware for the requirements of HIPAA. Your role is at the intersection of privacy, GRC, product, and engineering. And lastly, you have at least one security or privacy exec to garner the support from other management teams. Now, why? Why do we need to build a privacy operations center at the first place? First and foremost, there are legal and regulatory requirements coming up all the time. If you're working in the industry, you are well aware of the different state laws from New York, Virginia, of course, California, GDPR, and then some requirements from HIPAA as well, which mandates that you work across the organization with different teams to fulfill these requirements. Secondly, there are mandatory requirements from the app stores. So on the screen, I have two screenshots, one from Apple, the other one from Google. Apple mandates you to have a deletion button in the app if you're allowing your users to have the functionality to create the account from the app itself. And secondly, Google requires you to declare all the data that you're collecting from your third parties and how you're sharing that data with your third parties. Third, in the last quarter itself, there were three FTC slaps on the FTC on companies which are in the similar space as us. And this, the second screenshot is on the HHS website, where so far as of April 10th of 2023, there are 145 breaches reported on the HHS website. And this is just not the right way for organizations to prevent their financial and reputational losses. And once you have this POC, it becomes a lot easier to manage these different requirements for compliance. And lastly, there is always this ongoing media scrutiny. The screenshot on the screen is from Mozilla. They publish this report called Privacy Not Included every year. And each year, they give their score on how the application is performing with respect to their privacy and security practices. This screenshot for Headspace is from last year, where the results were not very favorable for us. And this is not the correct way to work or function an application where you have like millions of users using your application every single day. So it either helps you earn the trust of your users or lose the trust of your users. But with all that being said, and while we want to bring all of this together, we truly believe that privacy is an existential risk for Headspace Health. If we don't have privacy at the forefront of every single thing that we do, it's going to be extremely hard for us to compete and to survive in this space. And for that regard, every single thing that we do, from releasing to a new feature to building a new product, we have to have privacy at the forefront of everything. Now, before I jump into the Privacy Operations Center, I want to speak about what privacy is and how I look at the privacy at the first place. First, privacy is a fundamental human right. If you are having privacy in your product and application, it's not an add-on, it's a fundamental human right, and you have to take care of that. Secondly, it's a competitive advantage for organizations. I work with prospective customers all the time, and once we have these conversations regarding our competitors and ours, it just becomes evident that privacy is a competitive advantage for us. And if we are showing our leadership and thought leadership in building these privacy practices, it's good for the organization. And lastly, it's a foundation of trust. We have millions and millions of users across the world. And if we don't have this foundation of trust with our users, it's extremely hard for us to survive and grow. Now, how do we build this foundation of trust? It's an extremely simple process. First, we make promises. We make promises via our privacy policies, via our terms of service, via our notice of privacy practices. And then secondly, we keep promises. We don't want to do anything which is not aligned with the benefit of our customers or which doesn't enrich the user experience of our members. So this is how we build the foundation of trust, just by making promises and then keeping promises. Secondly, we should also talk about what privacy is not. So privacy is not only security. And I can give an example of that. Let's say you are having your data encrypted with the best encryption methods in the world, and you have this encryption key distributed to all the engineers. Is that data really secure? Yes, but is that data really private when all the engineers can access the data? No. Secondly, privacy is not a zero-sum game. Privacy can and need to coexist with innovation, efficiency, transparency, usability, and accountability. Many times we have this contention with the product teams and the engineering teams that, hey, we want to build this feature, but we have to keep this into account for our privacy. And we always come to this conclusion that we have to coexist both of these together. It's not an either or for privacy or usability. Can anybody give me an example of a company which does this really, really well? Apple, yep. Apple does this really well, and they are like the hallmark for us to make sure that we don't take privacy as a zero-sum game. And lastly, privacy is not solely an individual or organization's responsibility. We need the legal and regulatory frameworks to make sure that we have boundaries defined. Secondly, we need the industry best practices. There are a lot of best practices around security, but there are not the best practices around privacy that, for example, if I want to share a piece of data with one of the research partners, how should I go about it? That's still, we don't have an industry best practice for. And lastly, we have to foster a culture of privacy awareness. We speak a lot about security awareness in the organizations, that we want to prevent malicious insiders. We want to make sure that all folks are aware of the security practices at the company. But we don't give enough importance to privacy awareness, which is equally important. This essentially means that, do your members know when they need to share data with some other third parties, what communication tools they can use? Or are your employees aware of the research projects going on and how they can anonymize the data for their research purpose? And lastly, I want to speak a bit about the guiding principles of privacy before jumping into the POC. So for every single thing that we do at Headspace Health, we define principles and then we do the actual work. We have principles for our technology org, we have principles for our security org, and while we were thinking about having this privacy operations center built, we realized that we need to have guiding principles. So if there's ever a contention that which decision should be the right decision for us, we can come back to these principles and take our guidance from these. First one is consent. We want to be extremely specific in the consent that we ask, but at the same time, we want to give this right to users to withdraw the consent. Second is accuracy. We want the member information to be accurate all the time. And they should have the right to correct the information if there is an incorrect information in our systems or databases. Third, we want to secure all the databases, and we want to make sure that there is no unauthorized access, disclosure, or use via physical, technical, administrative sec cards. Fourth, we are accountable for complying with all the legal and privacy requirements. There is no other way around it. We have 6 or 7 requirements that is required by GDPR, CCPA to comply, and we want to provide all those rights to our members. Next, we want to be extremely transparent about our data classification, collection, use, and sharing practices. What data would we collect from our members? What data would we share with other members, and so forth. Next, we want to make sure that the information is confidential. And next, we want to embed privacy by design from the forefront of all the systems that we develop. We truly believe that privacy should not be an afterthought once we create the applications or systems. It has to be integrated with the SDLC. And I will speak about it a bit more, that how we can integrate SDLC and privacy together. If and when things go wrong, we want to make sure that we have the resources and we are prepared to inform members in a timely and transparent manner. We want to minimize the collection of data that we use. We don't want any data that will not use for the benefit of our members, which essentially means to provide them either better recommendations in the Headspace app or to just improve their experience when they're using the application. And lastly, while we are collecting all this data, if at some time we determine that this data is not required anymore, we need to delete that data or at least anonymize so it just doesn't hang around as a risk that we are collecting a lot of data which is not required. Now, what constitutes a POC at the first place? So while we were thinking about building this POC and there were like so many things that we could do, we realized there were 4 things that we really need to do, and we could just bucket all these things in these 4 pillars. The first one is governance and management. The second one is partnerships. The third one is tools. And lastly, security and awareness. So every single thing that we were doing at Headspace Health, we wanted to have all of those bucketed in either of these 4 buckets. Over the next few slides, what I want to do is maybe take some guidance from what we developed in our policies and procedures, and then go through each of these different buckets and how we can use that guidance for your data classification and your privacy operations center. The first one is data management versus data governance. This is the base of everything that we do at Headspace Health. By data management, I mean that you have to have organization of your data. You should have the storage of your data adequately protected. You have to protect the data, and then you have to maintain the data for adequate reasons. And if I talk about data governance, it essentially deals with frameworks, policies, procedures, and stewardship. Now, if I can sum up all the data governance points in one word, that would be strategic. All these things are driven by strategy. And if I can sum up all the things on the data management side, that would be classification, which is the base of every single thing that we do. So what I'm going to do over the next few slides is to start from classification and then slowly transition to the data governance piece. So for data classification, this is the traditional data classification. I'm sure you all must have seen this in some form or the other, where you have public, confidential, restricted, or highly restricted. But this data classification did not fit our requirements because Headspace Health is extremely unique. We are a telehealth organization with 2 products, Headspace, which is on the consumer side, Ginger on the care side, and this data classification just did not fit our requirements. So in this case, what we did was we invented our own. So this is the Headspace Health data classification. On the first column, we have the parent classification, which is sensitive, private, customer confidential, company confidential, research, and public. The second classification speaks to the child classification, which is PHI, SESPI, PII, customer confidential, and so forth. And there are a few examples for each of these. So right now, on the screen, you are seeing only 2 or 3 of these examples. But when we were working with our engineering teams, we gave them at least 15 examples of each. So when they are doing their data tagging for DSAR request, or when they are doing their data tagging for a deletion request, it doesn't come as a surprise, and they know exactly how to categorize and tag the data. But data classification is incomplete without inventory. We all know that you can have the best classification in the world, but if you are not inventorying your data and you're not tagging your data, it just doesn't make any sense. It will just lie in a spreadsheet and nobody will use it. But at the same time, complete data inventory is extremely hard. When we started doing this for the first time across the company, we realized that this is such a critical problem for organizations which are unique, which are in healthcare, or which are complying with different requirements at the same time, such as GDPR and HIPAA, which information you should delete, which information you should hold. It's just an extremely hard problem. So what we did, we had this initial milestone for the data inventory. We wanted to have this 9 columns, just the name, purpose, internal, external, storage, and the other columns. Fill these columns to the best of our abilities for all the data that we had. And we thought that once we'll do this exercise to the best of our abilities, it will make the other processes a lot smoother. We did that, and then we realized that this only covered the information we have. It did not cover the information that we were planning to collect by via new features or via our new practices that we were releasing. So we'll come back to this slide to tackle this problem that, hey, we did the initial data classification, but how should we keep this data inventory alive? Now, relatedly, I just have this one slide for DSAR requests. For those of you who are not aware, DSARs are data subject access rights requests, where users can come to you and then they can ask you to delete your information or delete their information, ask for their information, and there are 6 additional rights that they can ask for. And while we were looking for a DSAR tool in the market, we realized that there is no one-size-fits-all. If you are in a telehealth company, you have to comply with the requirements of GDPR, CCPA, but at the same time, you also have to comply with the requirements of HIPAA, which are very, very unique. HIPAA requires you to retain all the data for a period of time, and you just can't delete that data no matter what. So we realized that after the entire year we spent on our demo and POC, it's just not the right solution for us. So we built our solution for processing the DSAR request. So this is one slide that I wanted to highlight, that if you are thinking about onboarding a tool such as OneTrust or security, please be extremely mindful that your use case could be very, very different from what they are already serving. And it just might make more sense for you to build your own tool and not onboard one of those tools. And lastly, whatever you choose to do, just keep it alive. If you are inventorying your database, make sure that that's alive. If you are having your DSAR tail built yourself, make sure that the scripts that you have are up to date and they are collecting or deleting data when you are storing that data in a new third party. So coming back to the earlier slide, where we only covered the data that we already had, and we only inventoried that data, how we'd go about collecting the data or inventorying the data which we'll cover or which we'll collect in the future. So for this phase, we realized that privacy impact assessments are extremely helpful when you're collecting new pieces of information from your members. But if I am part of the security team and I go to the product team and say, hey, I need to do a privacy impact assessment, can you help me out with that? They'll be like, no, we have some roadmaps on our quarter and we have to do this as soon as possible. And from my experience, I realized that anytime there is legal team in your email chain, it just makes the entire conversation a lot easier. So I would implore you to make legal team your best friend for every single thing that you're doing. Now, this is one of the procedures that we developed across Headspace Health. And while we want to do a privacy impact assessment for each of the new features, we realized that unless and until we have a dedicated workflow for how we want to do that with the product teams and the engineering teams, it's not going to serve our purpose. So on the screen right now, we have 3 different buckets: product, engineering, legal, privacy, and security. And this is something that we recently rolled out, that every time we want to build a new feature at Headspace Health, it goes via this reviews. So the product team, they build their PRD, they give the PRD to the engineering team. The engineering team creates a tech spec in relation to the PRD. Both of those are submitted to the security, privacy, and legal team for their reviews. The legal team performs their own review, which essentially means checking all the regulatory requirements that we need to fulfill. For example, if you want to roll out a new feature in France, the French authorities want all the privacy policies and terms of service in French. So those are some things that we want to highlight as much as early in the process as possible, rather than going to the product team and saying, hey, we did all the development, but we still don't comply with all the legal requirements. The second thing is the privacy review. Now here, privacy team, they go in and make sure that every single piece of PII/PHI we are collecting, it's cataloged, it's remarked that why we are collecting that PII, and then if we need to minimize that data collection, we propose that to the product team. And lastly, the security team performs the threat modeling on that PRD. So if I receive a new feature request, me or either my team, they perform the threat modeling. And also, once we develop the feature, we conduct an internal pen test. So if we are releasing a feature which is going to affect millions of users, we don't want to roll that feature out unless we do an internal pen test. So we created this entire workflow to make sure that all of these different pieces are covered. Once we do all of these, we propose our recommendations to the product team. Some of these are blockers, some of these are good to have, but this has served us really, really well so far. We rolled out this process in April of this year, and so far we pen tested 3 features, we pen tested, we reviewed 4 PRDs and tech specs, and this just streamlines the process a lot more when you have the entire chain in your Jira ticket. Now, while we want to have all these processes done, we don't want our engineers to keep hanging in and just thinking, hey, what we are doing to embed privacy by design in the SDLC. So right now, we use these 3 tools for shifting our privacy focus from left to right. The first one is Privado. And what Privado does is, every time a developer asks for a new piece of PII or PHI in the code, it asks for a reason that, hey, I see you are collecting this piece of PII. Can you give a rationale that why do we need this piece of information in the first place? Secondly, now we are at a better space where we are much more mature in our data classification and labeling. And now we move to Amazon Glue for automating all of these. And then lastly, data governance, which is equally important. So while we are planning to shift all our privacy by design focus towards the left, we realize that it's extremely important to have this towards the right as well. And I can give an example. So let's say if there are Headspace engineers and they want to access a database which is for Ginger, it just makes no sense why somebody who is working on a different product, they need to have access to another database. And what we did was, with the help of this tool, we created some guardrails and policies so that every time this happens, we receive a notification, or either their manager receives a notification saying, hey, this is happening, do you approve of that, or what's going on? So this is our effort of shifting privacy from left to right, which is still in the operationalizing phase, but we are really, really hopeful for this one. This is something that we are still trying to operationalize at Headspace Health, which is the privacy threat modeling. So while we have a very, very good team for doing the security threat modeling, we realized that it's a budding requirement that we have to have a privacy threat modeling as well. So while I was researching all the privacy threat modeling papers, this is one of the papers that Professor Hoffman wrote. And he divided the entire privacy threat modeling in just two buckets. The first one is data-oriented, where he says just minimize the data you are collecting, abstract the collection of that data, or make sure that you are limiting the processing of that data, separate the processing of that data, and then lastly, when you don't need it any further, just delete the data or make it unlinkable. The process-oriented is extremely simple as well. Inform your users about the processing. Provide control to your members so that they can refrain from processing their data. Enforce this processing in a privacy-friendly manner. And then lastly, demonstrate that you are doing all of these in a privacy-friendly manner. So this is something that we're still operationalizing at Headspace Health. And hopefully, we'll take our own sweet quarter to learn about this model and operationalize this a lot more in the upcoming quarters. The fourth bucket is security and awareness. So while we talked about governance and management, while we talked about the tools, while we talked about the partnerships with the legal teams and the product teams and privacy teams, it's equally important to focus on privacy awareness, because this is one of the most important reasons for developing this entire privacy operations center. So what we did at Headspace Health, we developed our own HIPAA security trainings, which essentially means that this is extremely catered to Headspace Health. I've seen a lot of organizations using HIPAA trainings from organizations or just LMS platforms, which is extremely generic, and it did not serve our purpose. For example, we don't allow PHI to be shared via Slack, but it's just so hard to let all the users know or the employees know that this is not allowed. So we created our own Headspace Health specific HIPAA training. We have monthly office hours with our CISO and the DPO. And what we do is we open this office hours for the entire company. So they can come in and ask any questions that they have to the CISO and the DPO. And all the questions that they ask are then cataloged in our master privacy FAQ. So every single thing that we do, we have like a 50-page master privacy FAQ, which speaks to the privacy practices for Headspace, security practices for Headspace, and then similarly for Ginger. And then we have dedicated channels for our research team and engineering team, so if they have any questions, they don't have to go back and forth. They can ask those questions right there and then, which just keeps the knowledge cohesive across multiple teams. And lastly, we have a privacy intranet for open for all the company. And in that privacy form, when new hires join, we implore them to just go through the intranet, read through the master privacy FAQ, and ask as many questions that they have in the form of via form. So once we have this form, we answer or respond to that question, and then all that knowledge goes into our privacy master FAQ, which is open for the entire company. All right, so I just want to summarize this entire presentation is in 3 bullets. First, recognize that privacy is hard and industry guidance is vague. We have a lot of industry guidance on security via NIST, via SOC, via ISO, but the industry guidance on, let's say, data sharing practices or how to comply with GDPR, it's extremely nascent right now. And there is a need to have this industry guidance more robust. Secondly, there is always an opportunity to improve. And this is something that we learned while we were doing our data inventory. When we had this initial Excel sheet filled out, we were like, we have all the data inventoried now. We are doing a wonderful job. But then we realized that we did not account for any of the information that we'll collect in the future. And then we need to update our scripts that we use for our DSA requests. And then we realized that there's always an opportunity to improve. And lastly, when in doubt, just ask yourself how this will look like on the front page of WSJ, which essentially means that if you are not sure that, hey, should I make this decision for the users, or should I make this decision for the product, just ask yourself and let this question guide you on your decisions and influence your decisions with the other teams as well. These are the three takeaways that I have. First one is security enables privacy. There is no other way around it. Security has to be married to privacy. And as much as we want to segregate both of these, it's just that they have to be married and they have to work cohesively to enable privacy practices. Second, put members first. This is one of the Headspace health values, that for every single thing that we do, we want to put our members first and give them the reason of doubt or reason of benefit that if we are in a contention that we should we do this or not, we should just take this ginger value that we want to put our members first and keep this into account at all times. And then lastly, we want to build the world's most trusted mental health organization. And we recognize that it's not possible without the support of the industry and without the support of external members. So if I presented something on the slide that you don't agree with or you have any additional thoughts, please let me know and we can work together on building practices which can be shared across the industry. Telehealth is an extremely new industry for the entire world, and we are all finding good practices for security and compliance. So if you have such practices or if you agree, disagree with any of the things that I spoke about, please let me know and we can have a very, very thoughtful discussion on that. Lastly, few resources. I talked a lot about the marrying security and privacy and making sure that we have this guiding principles of privacy. So I wrote this book, the CSRS handbook, and there's this chapter 17 where I kind of jotted all these thoughts in extremely detailed manner. That when we think about having privacy and security go hand in hand, how it should look like, what each of these principles mean, how companies should look at privacy threat modeling, and so forth. So that's one resource that I would highly recommend. The second one is conferences. There are two conferences, the Use Next paper and then the Rise of Privacy Tech, which are extremely informative. The third resource was my starting point for my work in privacy. I am from the security and compliance world, and I had no idea about how to start in the privacy world. And when I read this paper for the first time, A Taxonomy of Privacy, it just opened the entire world for me. There are so many wonderful nuggets in this paper that if you are remotely involved in privacy and security, you should absolutely read that one. And lastly, IAPP, which has their own set of resources. They have a lot of different resources and trainings that you can use, but I would highly recommend at least number 3, which is A Taxonomy of Privacy. That's just super, super helpful. This is my contact information, my email, shobhit@grcmusics.com, where I haven't wrote in a long time, and then my LinkedIn, and the slides will be available at the last URL. So if you missed any of the slides and you wanted to have the picture, you can download the entire slides from there. All right, that's all I have. I'll open the forum for any questions now. Yeah.
With your inventory, are you doing any sort of privacy risk where you're marking like which ones of these do we have encryption or other data masking techniques in use?
Yeah, so the tool, or the question is, with our encryption or inventory that we are doing, are we also doing the encryption methods, or we are tagging the encryption methods as well? So all of that is taken care by the data governance tool that we're using. It shows this data is encrypted, or for example, if there's a bucket on S3 which is not encrypted, which has PHI, it just shows that you have this bucket, you have all this PII in here, which is not encrypted. So that data governance tool becomes extremely handy when we want to do a risk assessment on our inventory or all the data sources.
Options go and ensuring you don't overwhelm users with all the privacy choices?
Yeah, the question is, how do we remain transparent with all the privacy practices without overwhelming the users? And for this one, we always take this approach which is best for the users. I would like to answer that with the help of one of an example. In GDPR, you are required to have a cookie consent disabled by default. But in CCPA or the US, it's not required. It's an opt-out, not opt-in. So when we have to make this decision of opt-out versus opt-in, we always keep users' privacy at the forefront. So right now, if you go to the headspace.com website or ginger.com website, all of those are opt-in. You have to opt into all of those choices. We don't have that as opt-in for the US, even if the law permits that, because we think we should always be extremely mindful of data that we're collecting, and that may not be required. Yeah.
I was going to say that in a national security context, there's a lot of this data labeling and procedures. And I think a lot of these problems, there's analogs to what you're doing here. Have you looked at any of that material, or is any of it relevant to how you operate?
Sorry, which resources you spoke of?
Sorry.
Could you repeat your question?
Here. Oh, I was saying. Oh, thanks. Yeah, it just struck me that a lot of the problems you're solving here with data labeling and handling is reminiscent of national security data in some ways. I'm just wondering if you've looked at that and looked for parallels or ways you can utilize existing approaches.
Yeah, NIST recently released their framework around privacy as well. While they have a bunch of things on security, they came up with this framework on privacy. And when we were looking at this framework, we realized that that's not really applicable for telehealth. So we had to build our own practices. That's good for a general sense and general privacy practices. But while we want to take this industry standards for telehealth, it just becomes extremely hard because we have to have compliance with HIPAA, and then there are a bunch of different regulations as well. So we were not able to implement any of those industry standards for our own company.
Thanks.
Yeah. All right. Any additional questions, comments, thoughts? Okay, I'll take that as a no and maybe give you 12 minutes back. Oh, you have a question?
I guess out of curiosity, did your company ever look at things like zero knowledge proofs and some of those, up and coming technologies for your implementation? And I guess, do you have any thoughts on those technologies?
Yeah, I had one slide here which I intentionally did not present, which was around the vault architecture that we developed. So what we did, we have this patent at our CISO with many of the engineers. We developed this architecture on our own, where the encryption key for our crown jewels is stored on the browser itself. So while we have all that information on databases, that's all encrypted, but we also have another layer of encryption which is stays on the browser. So the public key that stays in the browser in one of the password managers, that public key always goes to the private key of that particular system, and then that data is decrypted/encrypted on the browser itself on the endpoints and not at the database level. So we have two sets of encryption, one at the database level and then also at the endpoint level, which is at the browser. So that kind of serves as our purpose for zero trust knowledge, or whatever you call that out. We are not looking at, if you are asking about homomorphic encryption or something like that, we haven't looked into that at this moment.
I got you. No, that's interesting. Thank you.
Yeah. All right. Thank you.